Hello and welcome. Today in this presentation, we're going to go over some key understanding of exercise science and physiology anatomy and link that into somatic psychology interventions and practices. My name is Stacy Reuille-Dupont. I have a bachelor's degree in kinesiology, which is the study of human movement at work and at rest, as well as a degree in community counseling and a PhD in clinical psychology and somatic psychology. Let's get started. This is one of my philosophies when I think about how I do interventions regarding the whole person. So movement facilitates the physical wiring and structure of being. It creates concrete manifestation of the abstract, meaning that we can use movement to create situations that the person can actually feel in a very tangible, touchable way. And that embodied experience becomes very tangible, and even a thought or emotion is movement at the cellular level. So even just helping people with thinking and or processing through feelings and emotional regulation, we are helping them move their body in a different way. My journey to this work begins when I was young. I was a student wanting to be a psychiatrist and had some physical health problems. As a result, I decided medicine was not the degree I wanted to pursue, and I wanted to be more proactive in healthcare. So I went into the field of exercise science, fitness, wellness, and working in fitness centers. However, my clients kept crying. So that I had these situations where somebody would actually cry, and at that point they would then meet their goals. And as a result, I circled back around to psychology, ended up with a master's degree, and working for 9 years in community mental health, where I did a variety of different roles, including integrated care alongside primary care physicians, as well as going on to get a PhD in somatic psychology, because somatic psychology allowed me to meet the clinical need in a very distinct way, especially looking at physical trauma in the way that physical trauma disrupts the body. So a little different than when I was looking at a potential PhD in exercise psychology or sports psychology. The somatic psychology realm offered me this really interesting and different way to look at the experiences our bodies hold and how those experiences then become part of who we are. So in my office, I found that people, and I did see a lot of folks with trauma in their background, weren't exercising even when they knew that they needed to. And I wondered why that was. So I did some research. As part of my graduate work, I looked at a clinical population and what were their barriers and perceptions around physical exercise participation. And one thing that I found was that it was not trauma that had mitigated that, it was panic. And so what was happening to people is they were feeling this overwhelming sense of panic, and that was too high on the nervous system, and they weren't able to engage in exercise, which also hits the same axis, which is the HPA axis of the body, the stress axis. And as a result, they would quit or wouldn't engage. And then I was often dealing with a lot more of the shame and the fallout of not being able to follow through on the recommendation to exercise without a real clear understanding for the person of why they couldn't. And and the other piece of that was the more substance use diagnoses the person had, the less barriers they had and the more participation they had, which led me to, well, many of them told me it's because when you're in jail, there's not a whole lot to do but work out. And I've lost my driver's license. I have no choice but to bike or walk and get myself around town. What that did when I was in conversations with the folks is help me understand that yes, the panic and the anxiety disorders were part of the problem for having people actually come into their body and do physical movement in a way that was actually helping them. But it also helped me see that it was exposure to doing the exercise that actually helped people move through and get more of it done and recognize that it actually could help them. So I started creating interventions to help people make that happen. I got a little grant to do a pilot program, and I took 13 people through an exercise-based protocol. I walked with a lot of clients one summer, miles and miles I put on. in each client, then we would tailor that movement and that teaching of the body awareness depending on their disorders. And then the third year, I looked at a population through the integrated care clinics where I did not program for mental health. I programmed with a nutritionist for physical health using behavioral economics and payouts for goal attainment. However, people still kept coming in with mental health issues, and those were primarily what they wanted to focus on. So again, I was getting hit with this idea that people really want to do a lot in their body. They want to move and they do not know how, and that their body is overwhelmed, and that feeling and those sensations are getting in their way of actually being successful. So I started to think about it in these four different topics of, we're looking at it from kinesiology, what is the movement and the mechanics of it, the endocrine system really running the show as far as watching how that stress hormone in the HPA axis plays off itself. And then how do I work with postural deviations, movement misalignments for corrective exercise, but also looking at how do those movement patterns and those posture pieces relate to the belief in themselves and their past experiences? And then how could I give them exercises that they could use right away that I can then teach to you so that you can start using those exercises in your office without any sort of special training or degrees beyond what you have, to really start implementing movement as a base, and then know when you do need to get an extra specialty. Part of why I do this work and why it was so important to me is I worked in the fitness industry and I saw people day after day, hour after hour, trying so hard to meet physical health goals and failing. Some people did great and some people did not do great. And they would talk to me about all these other things that were going on in their life and all the things that they really felt were in their way, and yet they weren't able to manifest behavior change in the way that they wanted. And I knew that it was bigger than just calories in equals calories out and all the science and math that I could program for them. The program should be working, but something else was in the way. In addition, when I worked in the clinical mental health center, part of what I found was so many of those folks had comorbid physical health problems. And those physical health problems were often in their way of feeling their best, which was getting in my way of helping them understand how well they could be doing with their mental health treatment. In the integrated care clinics, of course, those are focused on physical health care, and people were struggling to adhere to medicines. They were struggling to adhere to protocols for things like diabetes. And we know on average, people with mental health illness tend to die younger, and they tend to present in primary care with 5 or more unrelated symptoms, things like breathing problems, digestive problems. And as a result of these unrelated symptom presentations, they're very hard to treat and they often get mistreated in the way of pharmaceuticals. So they end up with a misdiagnosis and then they end up on a pharmaceutical pattern that really kind of wreaks havoc on their system, their body, their microbiome, creating more problems for them in the long run. And many people that I worked with, because I did work in clinical mental health, where I saw a high level of people who had been disenfranchised or had very limited resources, high levels of trauma in their lives. They just really were disembodied from who they were as a full self, and the body was a dangerous place to be. I worked a lot with substance use disorders and folks who had been in the incarcerated systems of the criminal justice system, and the body was such a dangerous place to be, yet it's the vehicle that they had to be in every day. So helping them come back into this body that could be powerful for them and help them move them forward was really, really important. So when I think about kinesiology, I'm always looking at it from the exercise science perspective. And these are my favorite 3 areas to really look at. The endocrine system, so that HPA axis is such a key piece to both trauma presentations and that sustaining of trauma in the body, as well as looking at breath, heart rate, stress, high blood pressure, emotional intelligence. Part of what some of the research shows us, if somebody has high blood pressure, they often can't name their emotions very well. When we teach them how to name their emotions, we can get their blood pressure to drop. So there's some very interesting connections between our mental and physical health that show up in the endocrine system, as well as in the gut. So the gut health is all the rage right now. Things around the microbiome, gut flora. We see lots of people with digestive issues in our offices, whether we call it nerves or whatever. They're having trouble with the gut and digestion system, as well as lots of levels of inflammation and immune responses that really wreak havoc on that microbiome and again create some digestive problems. And then one of the favorites is the electrical system. So we've got the nervous system with some pressure points, fascia, the heart, the brain that work on these electrical systems in the body. And as a result, we then connect into the greater field around us, like why your radio kind of gets staticky when you walk by it sometimes, or we can feel each other in a way. And then we can't see that field around us, but it's there, and we can sense it in our bodies and in our minds, and then we make judgments about it. So looking at the where the body is in relation to the exercise or the movement sciences, and then also where we are and how we develop our sense of self from the psychological sciences becomes a very interesting overlap. Now, looking at anatomy from a kinesiology and exercise science perspective, these are the planes of movement that we really study, looking at the sagittal or right and left, the coronal or the frontal plane where we've cut the body in back and right or back and front, and then the transverse or horizontal plane where we're really putting the body in top and bottom. Those are all places where we can look for misalignments, we can look for postural deviations, we can look at where energy kind of gets stuck, like where they don't seem to be moving, where they seem to be holding too tightly, that there's not flow between the muscle movement patterns. We can also look at, is there an imbalance right and left, front and back, that kind of thing. That really helps us as psychologists know what is it that this person might be feeling or thinking about themselves, because this is how they're putting themselves out into the world. So one of the areas that is fun to look at is, what was this body built for? And as you study the bodies, when you just make that gut judgment, what do you think that instinctually that body's built for? Are they built for a heavy load? Are they burdened? Are they built to escape quickly? Are they built for agility and to move quickly? As you start to look at bodies in that way, you start to kind of get guesses about what might be going on in that person's experience. And so as we start to talk to them about that, we can be wrong, of course, and usually being wrong in the psychology office means you've got more fodder for the mill, where you're really just getting more clear and more clear about what's going on for them. Remember that the body is somewhat of the past. So the body is this vehicle that they've used. And when you look at the body today, it is a representation of where they have been. And not that we can't change it today. We absolutely can with some mindfulness practices, breathing, and then new exercise pattern correction. And what you're looking at today is most likely the manifestation of who they were. And then finally, biomechanics is really that study of the movement patterns. So it helps us look at the whole chain from the bottom up, is usually how I start, from the feet, moving up through the legs into the hip and the pelvic girdle, and then up through the thoracic spine tends to be a very important point to focus on as a psychologist, up through the shoulder girdle, the neck, and the head, and then looking at how they use their arms, how they use their legs, how do their hands manipulate, how do their feet manipulate the environment. All of those pieces can be a lot of information for the psychologist, and from an exercise science perspective, help me understand where things may be stuck, where those imbalances are, what do they need to change, what do we need to look at as a movement or a neuromuscular junction piece that could help me switch how they might think of themselves in this world, and where they see themselves in movement and ability and power. So, setting on the foundation of kinesiology and exercise science, we are going to then take psychology and overlap it with some of the locomotor development. So, as I think about it like these squares, where we have this spiritual body or we have this spiritual awareness connection to something larger than ourselves, we're gathering and obtaining information that's then being filtered down into the physical system that becomes part of our physical, tangible body that we manifest our experience within. And then coming in from the sides all the time is going to be influences from the mental world, which is more of that intellect and the thinking and the thoughts and the predicting and the planning, and our emotional body, that body that's the first line of intelligence. It's the first awareness that's coming in. All of it goes in through the heart, which is the heart symbolizes, and the heart center symbolizes that attachment out into the larger world. So both the front of the heart, the back of the heart all become very important players. We've got the heart line running down the hand. If we look at energy systems and meridians, and that the hands kind of represent being able to reach out and embrace where we are, with the shoulder joint being one of the most vulnerable in the body. So the psychological development coming in from these four areas, but always being metabolized or manifested through the heart. Well, when we look at the locomotor development, we can see things on the spiritual side, like there's something about protoplasm where we're always connected in, and it's talking, and it creates, and it moves, and it's always getting information from somewhere, along with collective learning, cultural influences, those things that are bigger and larger than ourselves that then change how we see ourselves in the world. Comes down into the body through mirror neurons. When I see my mother do something or my friend do something, my body goes through that process too, because my mirror neurons are picking up that information. We've got limbic resonance, how we know how other people are feeling, that connection that we share with other mammals, and we co-regulate each other. So through the vagal nerve, through the nervous system, if I slow my heart rate down, I slow down the heart rates of those around me if they trust me. So when I'm working with people, I can change my breathing rate, which is tied to my heart rate, which helps them calm themselves as well. So when we're looking at that right brain to right brain connectivity, what we can see is that we are connected at a much different level than we may have ever thought before. Then we look at thoughts and emotions, both of which create chemical and electrical changes within the body just by firing of the neurons. And those changes in the body change the tissues. They change how we hold ourselves. They change what we believe. They change how we perceive everything that's going on around us. And they do that through neurotransmitters, neurotropic factors, hormones. So everything that's happening to us is happening at this chemical electrical level, and it's being transmitted in through the nervous system, which then is part of the heart rate, which is the easiest place that we can start to change and manifest something different, especially as the psychology person working with someone. We can start teaching them how to breathe differently very, very quickly in our offices. Over the next few slides, we'll just be fitting some of those pieces together. So if you think again about the spiritual being larger than us and it guides all, it's this unseen connection that we have to everything around us. And then the physical is that base which all else is created. So that physical base that we have is that tangible manifestation of those things around us that we're pulling in, that we're digesting, that we're able to then create something more concrete being within our body, grounded in experiences and energy, and allows for focus through concrete and tactile opportunities and connections. So we can use that physical base to then impact and fluctuate with the rest of our systems. And then when we look at emotional, it's our first line of intelligence. That information comes in and we have this physical sensation that then tells us, ooh, something's okay, not okay. But we have this physical feeling first. We then label those physical sensations as an emotion. We judge them, we label them, usually based on past experiences. And then that as we have those judgments and those labels, we're bringing in the mental intelligence system. And again, both of these are changing the physical structures as we're having them. And we may or may not be aware of all the different pieces that are feeding into our judgments, our labels, and those changes. And when we look at the heart, it's the thing that then puts everything else together. So the heart really takes our thoughts and emotions, that those chemical electrical changes that happen are then in our bloodstream, and pumps them through the system, bathing the cells with these changes. So now we have mind living in every cell of the body, as well as those different experiences are being manifested and communicated at those very small levels. And here's where I bring movement in. So I've never been one to be able to sit still very well. And I've always used movement as a way to ground myself in my own experiences, whether that's sitting in a classroom, whether that's driving down the road. I do a lot of different small little movements, but that help me stay present. So movement changes the endocrine balance and influences hormones and neurotransmitters, again, upregulating, downregulating the nervous system. They create patterns and postures in the neuromuscular junction operations, and this results in changes impacting physical structures. And it also helps us recognize what's happening. So if I'm always bent over, I get a very different perspective than if I'm standing up tall in my posture and anatomy are in alignment. That we label them based on past experiences, which may or may not be accurate for the current moment. So when we can do corrective movement, it can unhinge the past, allowing for new learning of the self in relations to others and the environments. This changes brain structures, and it allows people to have a different experience of themselves. And when we have different experiences, the brain rewires itself differently. That plasticity is there, and we can bank on some new learning happening. So these structure changes then influence the ability of us to manage and adapt within our environments with more flexibility and fluidity, which is the sign of mental health. The more rigid I am, the more concrete I am in my thinking patterns, the more I'm likely to get myself in a jam with black and white thinking. And in cognitive behavioral therapy, we call that all or nothing or rigid thinking or cognitive distortions around thinking patterns that seem to have us locked into behavioral patterns and then emotional patterns as well. Movement is something that can get underneath those conscious pieces and really help shape a different perspective. So, again, movement just allows for that exploration, and it allows space for creativity, which is very important for mindfulness, which is really important for helping people change how they see the world and themselves in it. So I use it based on metabolic change protocols, which often has to do with physical health management. I do see a lot of people who have physical health problems that are comorbid with their psychological health. So chronic pain conditions, diabetes, obesity related issues. I get a number of referrals from orthopedic surgeons and gastroenterologists who are working with folks who really struggle to have healthy systems. Either, they're coming out of surgery and we've got a joint replacement, or they're going into surgery and I've got to help with some anxiety, depression prior to surgery so that they have a better outcome. Possibility, as well as folks who struggle with digestion issues, gas, burping, all sorts of different things that they can't find a medical reason behind, or their medical treatments aren't working for. These are some of the different ways that I can work with people based on those exercise science principles. So I look at target heart rate zones. What do we really need to do here? If somebody comes to me and says, I'm pre-metabolic, and I need to lose 50 pounds, I know I have to program something in a heart rate zone that's going to help them lose weight and or get their body to be more sensitive to sugar again, to insulin again. Um, so strength development, especially for people who feel weak or disembodied and not powerful in their body, strength development becomes an issue. I see a lot of folks who are aging and they want to be strong and able to do things like play with their grandkids. So again, helping with strength development helps them stay positive about who they are in the world. Power force velocity is really about speed and high intensity training protocols, as well as strength development mixed in with speed. And that can depend on what the person wants to do. Lifestyle management implementation, I do that a lot, which is looks a lot like health coaching, helping them understand what they may want to do, what changes do they need to make now that they have this chronic pain, or now that they've been diagnosed with diabetes or heart disease. Like, how do we actually make their life as well as possible? Biomechanics I already spoke about, but basically those are the movement patterns that I'm looking at. and looking at programming around. Socialized learning is very important for many of the different groups that I work with. So, again, I work with a lot of folks who are aging. Getting them social is so important to their mental health. So being able to have them work in groups or teams with each other, with friends, with partners, and talk about what they're learning, and even sometimes do some of the teaching so that they can really socialize their behaviors, their learning, and their goals. And then really working with them on incremental change theories. A lot of people come in and say, I have this big health goal. I want to be more healthy. I need to eat well. And they have no idea what that means. So often I'm working behaviorally to help them break down their goal using something like SMART goals, or just helping them be realistic and time sensitive to their goals so we can actually check them off. Behavioral economics can be really helpful here too. And then we know that when somebody tracks, just the art of tracking something is going to change their behavior. So I use a lot of tracking and behavioral activation techniques to really help people buy into and get ready for what they want to do next, and then be accountable to that. And some of my job really looks like coaching, whether it be physically coaching people, mentally coaching people to be their best and to reach their goals. It just depends on what they come in with and what they want to do. Some people were only doing this for mental health, so the movement looks a lot more like exploring their experience. Other people were doing this for both the mental health piece, but also for physical health, which looks a lot more structured and may look like something you might see in a fitness center or a hospital exercise physiology lab. So when we look at muscles, this slide just gives you a brief overview of muscle structure and sliding filament theories. Basically, these filaments, these little bands that you see on the screen, they slide over each other. When somebody has a trigger point or a knot, they'll say, I have a knot in my muscle. Often what we're looking at is one of these sliding filaments isn't working quite right because there's a buildup of toxins, extra calcium and extra other things that are in between that joint synapses that you see over here on the left-hand side of the screen. That synapse gets these toxins built up, the muscles have to move around it, it creates knots, and it creates a dysfunction in the movement pattern. And so then we can have pain, we can have postural deviations, we can see different ways that the person's been holding themselves, or maybe what they're afraid of, or the kind of bracing against can be something that we look at here. One of my theories, which I have not studied yet and I am working on researching more, is that do our emotional patterns also create some of these actual physical, tangible knots in the muscle that we would maybe in the past talk about just getting out after a long workout or through massage therapy? But can our emotions and our thoughts actually leave those traces as well? And I do not have evidence of that yet, and am working to look closer at that theory. The next two slides just show some postural deviations that are super common. Lower cross syndrome and then the upper cross syndrome on the next slide. But basically, these are postural deviations that are really, really common in many people. And in the boxes here, you can see what's tight and what's weak. So sometimes when I'm looking at these postural deviations, I am looking at these muscles to say, if I can help them stretch the tight ones and strengthen the weak ones, how do they then perceive themselves in space? What's their confidence? What's their sense of power and influence in their own body to be able to do what they want to do in their life? And how do they then use their body differently in space as a result of just manipulating the system by creating more flexibility and or more strength in some very common deviations that we see in many, many people? And this slide really goes over a number of different areas, not limited to these, but a number of areas that if we can add movement into their psychological treatment, we can influence these systems. These systems then influence how we think about ourselves, how confident we are, how we feel like we can help influence our life and our choices. And so just using some movement can help with these different systems in the body. One of the biggest questions I get asked is, how do I actually do this in my office? So one of the ways that I do this is Tabata and Hakomi. I was trained in Hakomi. And I took some of those concepts from the character maps and some ideas around different developmental stages from the Hakomi core woundings language, and then thought, well, if I can program for locomotor development at that stage using a very intense exercise pattern, because again, part of what I was seeing was that it was panic disorder and anxiety disorders that were really the hard part for people to get beyond, to actually participate in exercise to help them both physically and mentally feel better. So Tabata is a very hard form of exercise. It lasts for 4 minutes. By about round 6, we were really able to start reprogramming what they thought, and that core wound was able to really start to have a different manifestation of belief pattern in their system. And it just depended on the person, depends on what they're looking for, need, what they like, which Tabata we might pick, or how we might look at that Tabata, what movement pattern we might pick, and I go from there. Now, sometimes I'm using a system, so like Tabata, which is a very structured system. In exercise science world, it's well known, a high intensity interval training program. Sometimes I don't use any system, and it's really more of an exploration of movement. We might be looking at something that looks a little bit more like authentic movement, where somebody's able to just move however they want to move. We may be looking at using music and some of the dance therapy protocols where they're able to move the way their body wants to move, and we put different beats on to impact heart rate and allow them to really explore maybe different emotions or different presentations of the body through that, but not using any sort of structured system. Um, I'm trained in EMDR as well, and I often will use EMDR with an overlay of somatic, either touch or tracking, rather than sticking to the straight protocol of EMDR that's a little bit more cognitive. The newer EMDR protocols do include some more somatic tracking, and sometimes that can be really helpful if they have like a tight spot on their chest, say, but they don't know really what it means or what the significance of it, but it has something to do with whatever it is they're processing, maybe an early childhood trauma that does not have language yet. You can put the buzzer right on that spot. And so the person can be using self-touch. They can be doing their tapping on their own spot as well. That may help them. So it doesn't necessarily have to be something that I'm doing. Sometimes I do use my own, like I will tap on the place that seems to be the problem, especially when I'm doing EMDR for chronic pain and or migraines. I use a lot of somatic touch, which is somewhat part of those protocols, but using that to help the person really focus on those areas. So you can use facilitated nervous system release as well to help them, like say, progressively muscle contract and release so that they're moving through the body. They can be doing some of that on their own, as well as I could also be doing some passive stretching for them and helping with the Golgi tendon organ or the stretch receptors and stretch reflect in the muscle bellies. So that may just depend on the person. And then just a couple case studies from my office. So I had a handful of people go through some different protocols with me, and DI came out of her protocol saying, I feel so much stronger, and as a result was able to start setting more boundaries with her teenage sons, and as a result of that they became more healthy. Her son, her older son in particular, was headed down a path of drug use and criminal behavior in his high school experience, and she was able to start setting boundaries with him that he was able to receive, and they got much more effective as a family system. KA was someone who felt like she was one-dimensional. She would always talk about being one-dimensional. She was someone who had experienced childhood sexual abuse by a step-parent, and as a result really felt she couldn't get her needs met. Using the Tabata and Hakomi formula that I was creating, she got very in touch with her anger, was able to decide I can get my needs met and I can ask for help. And from there became what she called three-dimensional, and ended up becoming getting married and becoming a mother, because she felt like she was worthy of relationship and living. When I'd first met KA, she had just come off a serious suicide attempt. ER had been addicted to heroin, had been clean for 18 months, had just come off drug court, and was using a lot of Red Bull, about 5 to 6 cans of Red Bull a day, and had no realization that that kind of stimulant use through the day may set her up for a heroin relapse. She was really focused on her sobriety, especially since she was coming off of paper. She wanted to make sure that she was in a place where she was able to be successful and really focus on staying sober. So using high intensity exercise training and helping her understand her top edges of her ability helped her get the same energy and motivation that she was getting from caffeinated beverages, but allowed her to also help herself calm, which she had been getting from heroin. So she was able to relook at how she felt in her own system. RH struggled with some gastrointestinal problems, and really some of what her underlying issues were around life moving too fast and feeling like she was kind of running from behind all the time. So using some movement patterns and really a lot of breathing practices with her to help her slow down and experience her system really differently. So some very slow, tight movement patterns along with some deep breathing patterns. And then DE is of chronic pain, someone who's struggling with chronic pain issues, and much of it is related to some of her guilt and anger that she's felt at where she is in her life place right now. And so as soon as was able to talk about some of those pieces, she was better able to let go of some of the holding her muscles were doing, and therefore release some of her pain. With her, we did a number of inversions, modified inversions coming out of yoga practice, to help her really kind of cool down, to help her look at life in a different perspective, to help her, again, kind of just stretch and release some of those trigger points in her muscles. So really practical there. And then SU came in obese. She had in the past had a gastro bypass, and was gaining weight again, and really addicted to sugar. Very clearly would state, there is nothing sweet in my life but these sweet treats and these sweet beverages that I eat. And so through walking, I helped her start to really focus on her body in a different way. She was able to move with her grandchildren differently, start to look at weight, start to really focus on, I'm willing to let go of some of the sweet treats, and change her behavior patterns around her shopping and her food choices. And she continues to focus on what she needs to do to decrease her obesity, because she knows that will kill her if she doesn't do something differently, and that will take her away from her family and friends. So each one of these folks had slightly different movement patterns. Some of them were more structured, some of them weren't. Some of them were using some of the EMDR protocols, some of them were more freeform. It just depended on the person and what they needed. And sometimes that changed session to session. Another piece to the way that I look at using movement in the office is really mapping that early wounding that we see in many of the different theories of personality development alongside that locomotor development. So when I think about that core wounding of, can I be safe? Often that's a very early stage of life. Like, they come into this world and they just do not get that sense of safety from their caregivers. that's a very slow moving movement pattern for people. Often we're just exploring sensations. We may be looking at contracting or holding, expanding, unfolding, really just beginning to rotate. These are all very early movement patterns that we see babies do. Um, and when they don't get these done right, they have trouble moving on to the next stages of movement. Can I get my needs met? That next stage. We're learning to crawl at those ages. We're really learning to use diagonal movement, planes of movement and patterns. We're learning how to hold ourselves up. We're gaining core strength. So, all of those types of exercises might be very appropriate for somebody who really struggles to get their needs met. Can I be loved or accepted? If we look at that age range, locomotorly, people are developing the ability to walk, their right and left balance, their core is continuing to develop. They're starting to feel where their body is in space. What does this mean when I reach out over here and I can reach and grab things that I want? I can go get them. I can climb up on things. They're really kind of learning how to manipulate their body in space and time. When we look at 3 years to 6 years and can I express myself well, at this stage, people are starting to do lots of compound movements, right? Watch any child in that age range, and they're doing all sorts of complicated movement patterns, and they're doing all sorts of things sometimes all at once where they're twisting and turning and bending and pushing, and they're having so much fun in their bodies. So really helping them with coordination development, um, compound movement development of different muscles and working through multiple planes of motion as if we can, as well as really a lot of fun. How can we program movement to be fun and enjoyable? And then as we get into older than 6 years old, often it's how can I contribute, but also at this point, we're often socializing our team sports. We're having fun with our friends. We're learning that my role in the movement pattern matters. When I throw the ball to you, you catch it and throw it back to me. We're turn taking. We're really learning more continued refinement of how to use our body in space and time, as well as feeling comfortable with how I'm working with other people. All movement comes from the core. And when we're looking at using movement for psychological disorders and to help with healing of psychological manifestations, we have to look at the energy of those systems. So, with anxiety and depression, which are um, great ones to start with because so many people show up in our offices with these, even if they have more diagnoses, often these two are somewhere in there, as well as trauma. So if you think about anxiety as that sense of fight and flight, I can't be in this skin, I can't be in this place, I've got to get out of here. And depression as what's the point anyway? There's such despair and hopelessness and no motivation. They're very heavy and very, slow, and that we see the psychomotor retardation, we see their body move slower. We can't shift those energy patterns just by staying within the energy that created them. We have to move differently in the world to change the pattern setup. However, for most people, we can't just tell them to do the exact opposite. We have to meet them where they are and then do incremental change to actually move that movement pattern. So when we think about all movement coming from the core, we can start to see how all of this can come together and allow for a variety of movement options within their clinical mental health presentation as well. So let's take a moment and talk about anxiety. So, part of anxiety is feeling safe. People want out of here. They don't want to be in this skin because it's all buzzy and it doesn't feel good to them and they're scared a lot. So, we want small movements, creating safety and security, helping them with control. This might be super slow movements. It might be helping them get into really small, like little balls and help them move around. They can roll. There's all sorts of different ways that we can do that. They can kind of hug the body and put some pressure on their body. So there's different ways that we can do that help us control and get in touch with the thoracic spine, especially around the breathing patterns, as well as manipulating where their body is in space. And then we can get really big. So helping them move from these small, safe, and secure places into really big movements helps them take their space and place, helps them find their grounding, helps them allow them to feel like they can say yes and no to what they want. They can set boundaries that can be respected. They can be effective. So think about a lot of sagittal plane movements, which is right and left, as well as forward and backward folding, so that they're, again, when we come forward, we're helping that body feel small. And when we're going backwards, we're expanding so that they can start to feel that they're safe even when they expand, especially exposing the front of their body and their viscera. Anxiety folks, too, a lot of times I'll program with those guys around some interval training, some high intensity training to help them recognize how to control their heart rate so that it doesn't feel like panic every time their heart rate starts to increase, or that they start to sweat a little bit, or that they start to breathe faster, that they can learn control of that while they're in the exercise environment. And then when they do feel, they have a reason to be fearful or panicky, that they can then use those same skills to help themselves calm down and avoid a panic attack, as many people fear more panic attacks as part of the panic disorder itself. And then when you look at depression, think about it as being heavy and slow. So despair sets in, movements get slower, people's concentration slows down. So start by doing slow, heavy moves. It could be closer to the ground. It's nice to keep them on their feet, which helps keep them grounded. Not necessarily the only thing that could work, but having them do things like stomp, very slow. If you've got a kid, you can have them pretend to be something like an elephant, where they're just moving at this slower pace. But then we start to bring the energy up by raising the arms and legs. We can do some pulses. You can have them doing both movements at the same time. So they might be doing, and the example here I gave was, doing squats with some shoulder raises. So they've got this full body motion going on. Again, kind of moving into more compound movements and multiple planes of movement, but that's going to raise heart rate and it's going to raise breathing rate, and it doesn't necessarily have to be fast. And so that person who's moving at that slower pace now is able to start moving at a little bit higher rate because their heart rate is moving differently. And we want to be somewhat rhythmic with these folks. It can be helpful for them to move at a rhythmic pace and then to move that energy up in a bit of a rhythmic place. So I often am doing a lot of frontal plane movements with these guys, so some front and back stuff, mostly because it's easy to do things in that frontal plane that involve the arms and legs in a pretty not necessarily small space, but I'm not taking up a lot of space, but I'm asking them to move and at bigger rates. But again, it's not necessarily um, always like that. It just depends on the person and what they need and where they'll meet me and what they're willing to do. So with trauma, they often are oscillating between. So there's this sense of, I've something's off, I've got to ground. So rhythm can be really helpful because it helps people predict and feel what's coming next. Balance is very important for people. This helps them feel strong and grounded. I often start with more of some of the anxiety options that I use. So things that are small, things that might be helping them decide and determine things so they have a sense of safety, control, and power. I also use a lot of diagonal plane movement with these guys too, because they're often off in their different body systems. There's, the traumas being held in the tissues, and so there's postural deviations. And those diagonal plane movements often add an element of rotation, which helps facilitate flexibility and openness and balance. And so diagonal plane movements are often compound and create a need for balance and focus. And when you can help somebody focus very intently, they tend to get out of their head a little bit and then are able to pay attention a little bit more and focus a little more on their experience, which helps in the process of then reprogramming, especially if we're doing some talk therapy alongside of the somatic psychology movements. So um, helping them really come back into their body in a safe way is really important. So these examples here aren't the end all be all, and they're not all or nothing for everybody. But these are often what I find in my practice. These are some of the statements I hear a lot. I can't be big, I can't be tall, I can't be full. When we're working through some of these different movement patterns, helping people recognize their own repetitive negative pattern, and then how can we change some of those into positive statements while they're moving, so that the movement itself grounds the new thought into the tissues and helps ground them into this new concept and idea. And if the movement is actually helping facilitate, well, if I can't be tall, let's get really tall. And now they actually have an experience of being tall. It's a completely different world for them, and they feel themselves different in space, time, and place. So that can be really helpful. The twisting and rotation often helps people perceive themselves as more flexible. They may not be more flexible, but it really helps when they're looking at trying to be flexible in their thought process. So there's lots of different ways to do it. I do tend to see these in my office. And like I said, it's not an exhaustive list. So this slide shows a basic personal training protocol outline. We're going to look at doing something that would inhibit. So often you see this in foam rollers, like the guy there in the picture, where they're inhibiting something, and that's creating pressure along with some support, but it's also helping to break down those muscle knots and triggers, getting those sliding filaments ready to move in their full expansion and contraction. Then we want to lengthen. So this allows for full expression within safe range of motion limits. Lengthening is flexibility, but it's not flexibility training. It's just really kind of that simple stretching at the beginning of a movement. We can use both of these very well in psychology, because if somebody's feeling a little too open and unbounded, we can create pressure and support that binds them. And then we can, if somebody's feeling crunched or stuck or stagnant, allowing for that lengthening and that full expression of a joint within its range of motion can be really helpful for them to see, like, oh, I have options. I can move through the entire system, or through the entire movement, or the entire thought, or the entire, say, interpersonal interaction. After we do those, we're going to activate. So looking at, holding, isometrics, isolated movements. We're looking at strength, stability, structure here. It just depends again on what the person might need. Once the person's at a level of ability to hold those isolated movements and have enough strength and stability and structure, then we get into the more complex and diagonal plane movements, functional movement patterns that people do and that you see in a typical exercise class. So it really helps people know that things are going to be built in a way that's structured or safe, so that they're not going to be asked to do something beyond where they need to go. And again, this may be something where you want to get extra training, um, so that you've got more understanding of building a program. But when we're looking at just picking some of these out for psychology, say dynamic movement for psychology, like, oh, I could have somebody march in place along with swinging their arms rotationally around their upper body or something. I can have them, move their shoulder through their full range of motion while they march. That allows for a complex movement pattern or set of movement patterns, but it also allows us to really focus the body on the movement in particular ways to help their mind. So when you're coming up with these ideas, some of it is really looking at how you want to program for what they're presenting with. And again, you may feel like I need extra training in those areas to really feel confident, and to make sure that it's not something I'm asking somebody to do that would hurt them, because their body's not ready for it, and you may not know how to tell. So make sure that you're staying within your scope of practice as needed. Continuing with the idea of using some of the common exercise science concepts, part of what I started to do with the anxiety and the depression, looking at how I could use the standard personal training protocol to help people meet their mental health needs in addition to physical health needs, um, or just one or the other. Um, One of the things I ended up overlaying was the window of tolerance, looking at what hypo and hyper arousal looks like, as well as how I would use that model to treat, say, trauma, and then what exercise physiology training window can look like, where I have the anabolic threshold at the top there, and then at the bottom, we're at rest, and what that looks like in the different energy systems of the body, from an anaerobic system to an aerobic system. There's also the glycolytic system as well in there, but being able to say, how do I keep somebody where they need to be? Which mental health disorders benefit from starting slow at the bottom or pushing the top levels and seeing how wide we can make that steady state window, which is very similar to being able to regulate and be flexible in your emotional regulation and manage your environment well. So both of them, you ride the edges to create the window in a bigger fashion, and using some talk in the middle of that while they're moving helps them bridge that in both areas, and it really helps them expand those windows. And so they're not only using that physical health to help focus and or to help ground that experience in the body, but also being able to learn how to regulate themselves emotionally and from their nervous system perspective as well. So that concludes what we were going to talk about today. And if you have more questions or you'd like to consider some different diagnoses that you're seeing in your office, please let me know. I'm happy to help talk with you or even coach you through some ideas and options. I see and have worked with a lot of different folks in my office over thousands of hours, trying out some of these different things and then working with them to language it and to set it up and to try to figure out what meets different people's needs in different moments. And if you want more trainings around this, or you're interested in something, please let me know. I'm happy to try to figure it out and help you come up with something that will work for your practice. I hope you enjoyed this, and please don't hesitate to reach out if you have any questions or comments. I appreciate it. Thank you so much.